Well, it's certainly great to welcome you back to Connect. We're going to be joined by two smart individuals. Dr. Callahan and Lindsay will be joining us in just a minute. Lindsay, of course, was Miss Ohio. You may have seen her on TV in the last couple of years, but now she joins us. And tell us about the little miracle that's in your body.
I have a device called the Emblem Subcutaneous Implantable Defibrillator, manufactured by Boston Scientific, who I'm partnered with today. That is a device that continuously monitors my heart for abnormal heart rhythms, and should I experience that, it sends an electrical impulse to my heart and saves my life. It feels like a mini emergency room in my chest at all times, and I feel really safe, like I can just live a completely normal life, and I've been able to go on and spread awareness for sudden cardiac arrest and work on different legislative initiatives around cardiac-related causes.
Well, Lindsay, it's certainly wonderful that you're behind this campaign to make greater awareness, but tell us what led you that ultimately led to the implant.
When I was in high school, I was dancing 7 days a week, and I started having these episodes where I was fainting, I felt completely fatigued, I couldn't get my heart to calm down after routines, and I would look around and none of the other dancers were feeling what I was. And my teachers and coaches thought that it was my conditioning, that I was dehydrated or didn't eat enough, or that it was too hot out. And it wasn't until after dance class one day I went home and I ended up collapsing and had to be taken to the emergency room, where they discovered that I have a heart condition called hypertrophic cardiomyopathy that puts me at an increased risk for sudden cardiac arrest.
Well done, Lindsay. That medical term would have taken me days to learn. So thank you for introducing us to that. And Doctor, that's a perfect segue to you. Medically speaking, what has happened with Lindsay?
Sure. She has the condition, that she talked about, the hypertrophic cardiomyopathy. It's one of the leading causes of sudden cardiac arrest in athletes that develop sudden cardiac arrest. So of all the causes of sudden cardiac arrest, it's one of the most important. But it does put her and individuals that have it at risk for these electrical or heart rhythm abnormalities that can cause them to pass away in minutes if untreated.
And Dr. Callahan, how does the technology work, and what impresses you the most as a doctor? It's
really, it's one of the most sort of powerful treatments that we have in medicine. So often the treatments that we have, they work a little bit. They might help 30 or 40% of patients, but this makes a huge difference in patients' lives. If a person has a sudden cardiac arrest and they don't have a defibrillator, they're not in a hospital, the chance of them surviving is less than 5%. But if they have an implantable defibrillator like Lindsay has, those devices are more than 95% successful in rescuing the patient. So it's really impressive technology.
And what is the call to action today?
Yeah, I think it's just a call to raise awareness. If this resonates with you, if you're a person that says, gosh, myself or a family member, has some of those red flags, maybe they're getting dizzy or lightheaded or fatigued with activity more than would be reasonable, go talk to your doctor. But it's also a call to be aware of this sudden cardiac arrest and maybe go get educated, learn how to perform CPR.
And Lindsay, can you share a resource that was useful for you as it relates to sudden cardiac arrest?
There is a wonderful resource online called sicd.com, and it provides a lot of information about sudden cardiac arrest in general, as well as information on the device that I personally have implanted.
Well, we're certainly glad you have the device to keep you happy, energetic, and making a difference. And Dr. Callahan, thank you so much for caring for our health. It was nice to have both of you with us today.
Thank you.
Thank you so much for having us.